Hi, welcome to Riverside TV, where we are bringing you positive local stories. I'm Steve Brazel, and today we're going to be talking about Riverside City College's School of Nursing and their simulation laboratory. They received an accreditation. Now, the accreditation is from the Society of Simulation in Healthcare Accreditation Committee, and this is the interesting part. It's the first community college facility in California to earn this accreditation, and it's right here in our town, city of Riverside, California. So joining me today, I've got Sandy Baker, the Dean for the School of Nursing at Riverside City College. Sandy, how are you?
I'm great, thank you.
Nice to have you here. Also, Amy Vermillion, she is a professor in nursing and the director of the Simulation and Learning Labs. How are you, Amy?
Good, thanks.
So there's a number of ways I want to take this because as I was researching the new accreditation and the both of you, I noticed one thing, first of all, that really jumped out at me that I don't think I ever realized before, and I was born and raised in this town. RCC School of Nursing was founded in 1952?
Yes, that's correct. We were founded in 1952 with two of our clinical partners, it was the old Riverside General Hospital, which is now Riverside University Health Services, and Riverside Community Hospital, which is right across the street from us. And that was with our vocational nursing program that we were originally founded with.
When you just look at the School of Nursing and an overview of that, how many students go through this program a year?
Well, we have three separate nursing programs. We have our vocational nursing program that I just referenced. We have about 70 students who go through that program in 1 year. We have a registered nursing program, which was started in 1957. It was one of the original associate degree in nursing programs in the entire country. I think it was one of 5 in California. And that's our largest program, and we have around currently about 350 students going through that program. In a year, it would be almost 400 students. And then we have a certified nursing assistant program. That's our newest program that we started 2 years ago. And in that program, we take in about 75 to 90 students each semester because it's a 1 semester program.
So if I'm a student and I go in as an RN program or a VN program or CNAA program, where do I end up degree-wise?
The Certified Nursing Assistant program is a 1 semester program, and you get a certificate at the end of that program. And you can go out and get a job as a nursing assistant. A lot of them are in skilled nursing facilities. A lot of students take the CNA program because it's a prerequisite to our vocational nursing program.
Okay.
And to most vocational nursing programs, even not ours, but other ones. And so they can just transfer directly in with that certificate. But it is a certificate. They take a state certification exam that they must pass in order to receive that certificate. The vocational nursing program is also a certificate program, although many of our students end up getting an associate degree in conjunction with it. It's a full 1 year. They start at the beginning of the school year in late August, and they go all the way through the year to the following summer, and they graduate in early August. And finally, our registered nursing students, that's our most rigorous program. They have generally at least a year of prerequisite courses to take. If they participate in our concurrent enrollment program, which is with our Cal State partners, it's 2 full years. And then what they do is they enter our RN program, and then the RN program is 2 years to complete the RN program.
You mentioned it earlier, Sandy, and Amy, I'm curious. When the school was founded, you mentioned some of the partners that were involved with the founding of the school. And I know that there are a number of partners in the medical field that you guys work with now. Amy, tell me about some of the partners and what some of that experience is like working with some of those.
Well, our community partners are one of our strongest assets to our programs. And so they include predominantly, they're in the Inland Empire, but some of those clinical agencies are outside of the Inland Empire, but they include acute care hospitals, skilled nursing facilities, medical clinics like Riverside Medical Clinic, for instance. They include outpatients, dialysis centers such as DaVita Healthcare, And so we tap into the many clinical agencies and different facets of nursing within our community to provide our students with clinical experiences, especially depending on where their scope is in terms of scope of practice. So, for
Right.
instance, the vocational nurse, you're going to predominantly see in the healthcare clinics, urgent cares, that sort of thing. And so a lot of their clinical agency experiences are in those types of settings, as well as the acute care setting. Whereas in the nursing assistant program, their primary care setting that they work in is long-term care or the skilled nursing facilities. And so they're predominantly in those clinical agencies.
So we're talking about these students as they're actually learning, working with your partners for hands-on experience.
Yes,
I
absolutely.
mean, real world out there.
Yes.
With the multiple programs and multiple degree options. But I'm curious the types of jobs that they are ending up in your experience. And are most of the students that come from RCC School of Nursing, do they tend to stay local?
Yes, we actually track all of our graduates and where they go on. Do they go on and get an advanced degree? Where do they work? And depending on which survey, it's generally between 80 and 85% stay right here within the Inland Empire, meaning San Bernardino County and Riverside County, but right in this region. That's the wonderful thing about a community college student that's different from, say, a student who attends nursing school at a private college, or even in the Cal State or the UC system. Our students are generally older and they have stronger ties within the community. So
I'm glad that you track all that, because actually the part that you said that they tend to already be established here, right?
mhm.
They tend to be a little bit older than some of the ones going to a UC or a Cal State system, and tend to already have kind of a base here that they're training to almost specifically to stay here, which brings us to what I think is one of the coolest things. And when I was researching it and looking at the pictures, it's fascinating to me, the simulation laboratory. So I guess I want to start with a helicopter view, but you're talking about the simulation labs or learning labs in the simulation laboratory, but you also have a virtual hospital. So tell me a little bit about how those work.
So the learning labs, the way that they were designed, it's a 5,000 square foot space that can be either used as one large classroom or can be split into 3 separate classrooms. And in those learning labs, there are 18 hospital beds, or we call them hospital bays, if you will, that resemble a hospital environment. So we have head walls that are simulating oxygen, suction, equipment. And then we have a hospital bed and a medium fidelity simulator that is in each hospital bed, along with privacy curtains. Yes.
Medium fidelity simulator, is that what you said?
Yes.
Explain that to me.
Okay, so a medium fidelity simulator is a simulator that is, in our case, run by something called a SimPad, which is similar to an iPad. And the faculty and or the student is able to program in vital signs, listen to heart and lung sounds, feel pulses, and is able to do basic assessment, basic hygiene care, range of motion, those sorts of things. Whereas when we go into a virtual hospital, those are high fidelity, which means they are as close to humanly possible as we can get. So the student, the actual simulator in the virtual hospital or in a high fidelity setting is able to respond to what the student does, just like you or I would with an actual nurse at the bedside.
So these are effectively simulated humans in both cases, just with different feature sets.
Yes. And
Wow.
obviously the high fidelity, you could say they're like robots, if you will. The high fidelity are more sophisticated. than the medium fidelity, but based on the learning objectives for the student, it will determine what type of fidelity or realism that we use to teach those varying skills. And so in these learning labs, we teach the majority of our clinical nursing skills, and one portion of that learning lab is designed as an open lab in which our students are able to come in a self-directed fashion with oversight of the nursing faculty to practice their nursing skills and get assistance with nursing care planning, dosage calculation, and those sorts of activities. Whereas in the high fidelity or the virtual hospital, those experiences are scheduled for each semester and program throughout the curriculum. And students, depending on the learning outcomes and objectives for that experience, determines the number of students that participate and observe in those experiences.
You made a comment about a SimPad. And when I was reading up and kind of researching this before we talked today, the first thought that hit me was an airline pilot practicing in a flight simulator where you have somebody in a control room that can suddenly say, let's mess with him, shut off engine 2 and see how he handles it. Is that what the SimPad allows you to do, to take one of these medium or high fidelity simulators as a student's working on it and throw them a curveball, as it were?
Yes. I will say that in the virtual hospital, we do have that control room that you just kind of referred to. Those simulators are operated based off of laptops. And yes, we are able to do that more on the fly, if you will, and throw those necessary curveballs. And we're also able to program in those curveballs, so that so many minutes into that simulation activity, that curveball will hit.
I mean, these simulators can actually emit sound.
A high fidelity in the virtual hospital, we actually have microphones, audio and video, that come in and out of the control room, in which the faculty and or our nursing lab simulation specialist is able to communicate.
These simulators, the high fidelity ones, can be very realistic. They can not just vomit and cough, but they can, their pupils can dilate or constrict. Their lips can turn blue. They can seize. We have the baby that has a seizure and actually simulates a seizure. They can bleed.
Wow.
You can insert a chest tube in them or a catheter in them, and urine can come out of the catheter. So, I mean, they are very realistic. They can give birth. We have one that can give birth every 15 minutes.
And that kind of brings it all full circle to the accreditation. And Sandy, I understand that you have been absolutely instrumental in securing this new accreditation, first in California to receive it. Tell me a little bit about the accreditation itself and the process that you've had to go through to get that.
Well, I would love to take complete credit for it, but honestly, it was a very team-oriented approach. And Dr. Vermillion and Dr. Angie Fossen are certified as simulation healthcare educators, and they had to go through a training process and then a testing process to become certified like that. We also have a simulation lab specialist who took, and I hope I say this right, certified health operations
Certified healthcare simulation operations specialist.
Okay, there you
go. Okay. You'll never say that twice in a row. Go one more time.
Yeah.
Certified healthcare simulation operations specialist.
There you go. Nailed it.
And so he's our nerd, if you will. He's not a nurse. He is a computer guy, and he's actually the guy who runs the simulators and programs the simulators primarily. And so that team came together, and we went through the whole process of what's required to become accredited, what do we need to have, and then we've been working on this for the past year in terms of getting our policies and procedures in place, making sure that we had trained personnel and appropriate protocols that met with the standards of the accreditation process.
So it's been a long time goal, obviously, but the organization, Society for Simulation in Healthcare, SSH, is probably going to be easier. Explain to me the importance of receiving this for RCC from an organization like SSH.
Basically, there are standards and criteria that are set forth. And actually, SSH is an international organization that, in combination with Enaxle, they have best practices that have been published for simulation. And so the standards and criteria from SSH are developed based on processes. So you not only have to outline your processes, but then you have to evaluate your program and show how your program is meeting those processes that have been set forth by the simulation community and best practices.
This obviously, from a bigger picture point of view, super important for RCC, super important for your School of Nursing, and in my opinion, super important for the city of Riverside that we have things like this right here local to us, because with 85% of your students staying local after they graduate, we know that the staff that's working in the facilities we may end up in are well trained by people like the two of you. So where can people find out more information about the Riverside City College School of Nursing?
We do have a webpage, rcc.edu site, and you would go to academic programs and then you would click on nursing. And so we have information there. We do have a new website that is due to be published this coming fall 2020. Also, the Society for Simulation and Healthcare will be listing us on their website as a newly accredited program. And that accreditation is 5 years. We do submit an annual report every year, updating the society on our progress. And then we will do another self-study in 5 years.
Sandy, I can't leave without saying this. This is your the week that we're recording this on a Monday. This is your last full week of work. You are retiring.
I know, it's hard to believe. I've had 31 years with Riverside City College and 43 years as a registered nurse. And I have to tell you that there's been so many changes in the last 31 years. But I'm so proud for my years with RCC School of Nursing. I think we perform a wonderful service for our community in providing the most clinically competent nurses that are in the Inland Empire. If you walk into any hospital, you're going to find an RCC graduate. You're going to find several RCC graduates. They're ready to take care of you. And I think that what this accreditation does for us is it validates that we really are the best, and that your local community college provides excellent education for its students and for the community. And the other wonderful thing I just want to say is that 68% of our students are lower income. They're so low income that they actually qualify to pay no tuition costs at all when they attend RCC. So they 68%. So they are coming to RCC, not paying any tuition, graduating and becoming registered nurses, vocational nurses, CNAs, and making a wonderful standard of living for themselves and their families, and which helps our community. So
that's amazing. So again, Sandy Baker, Dean for the School of Nursing at Riverside City College. Thank you very much for joining me today.
Thank you for having us.
And then Amy Vermillion, Professor of Nursing, but also the Director of the Simulation and Learning Labs. Thank you so much for joining today, because really, again, I was born and raised in Riverside, and seeing what you two have done at our local city college, which in my opinion is a standard in the United States, just thank you both for everything that you've done. So to both of you, thank you again so much. This is Riverside TV. I'm your host, Steve Brazel. And as always, we are trying, especially during this unusual time that we're living in with COVID-19, trying to bring you some of those positive local stories. And I hope you enjoyed this one as well. We will see you on the next show.